I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today, we're talking about mental health access centers. In the face of mental health and substance use disorder, these specialized access centers are revolutionizing community-based intervention and healing. Several years ago, we introduced this idea to our audience, where law enforcement, hospitals, and mental health professionals could de-escalate a crisis in care and connect people with the services they need. Now, for an update on how this program is working, we've invited Erin Foster, the director of Linn County's Mental Health Access Center. Erin, welcome to the show. Tell us a little bit about yourself and what's been happening over these last couple of years.
Thank you, Peter. I'm so happy to be back to give you an update. It doesn't seem like it's been 2 years, but here we are. My name is Erin Foster. I am the Linn County Mental Health Access Center director. Like I said, it does not seem like we have been 2 years since we've discussed this concept. It seems that time has flown by. So since we've talked, we've opened. We still have some ongoing services that we're hoping to open, and I'm sure we can talk about that here as we go on. But I'm really excited to talk about, where we've come in the last 2 years with you.
Now, what other access centers are there throughout the state? Because as I understand it, you guys all work with a similar model and collaborate with each other.
We do, absolutely. All of us are actually designated through the Department of Human Services, or now the joining of both IDPH and HHS, or to become HHS, if you will. So there is a process to become an actually designated access center. Really, that comes down to the specific services that we have in-house. And so I believe they are close to having 9 designated access centers across the state, anywhere from the eastern side, the central side, all the way to the western side. And so although we see a lot of different types of patients, different individuals coming in just geographically due to the differences in Iowa, we all are seeing a lot of the same things and function a lot in the same manner. And so we do collaborate. We have a monthly meeting where all access centers come together, talk about challenges and successes and what's coming up next for individuals. So the collaboration across the state has been really good.
Well, so people have families all around Iowa, so there is sort of a continuum of care available to people if they have, say, family in one part of Iowa that's having a problem and they live somewhere else.
Absolutely. So our access centers across the state fall into the regionalization that mental health services in general. So my specific access center is in the East Central region. And although we function and work together with our region, anyone can go to any access center across the state. And we've seen that, all of us, where it may be individuals from a different region for a variety of different reasons choose to go to another access center. That may be just be service availability. It may be sometimes we know that stigma is still attached to mental health and substance use disorder, and they may not want to get services where they live. So although they are very regionalized in general with mental health services, all of us have seen people from across the state.
Now, also, the one thing about access centers, they have a very unique role in terms of working with public safety and hospitals. For those of us that don't know how an access center works and how this new idea has really grown, tell us a little bit about that.
Absolutely. So access centers function a lot like an urgent care model, except we're dealing specifically with mental health and substance use disorder crisis. So individuals can walk in. There's no appointment necessary. There's no referrals necessary. We function on a walk-in basis. They're triaged by very specific crisis counselor staff. And during that triage, we're getting to the nitty-gritty of what brought you in and what's going on. We realize that at its center, it's a mental health or substance use disorder crisis. But one, we don't define what someone's crisis is. There's not a checklist that we go through. And two, we take a very holistic approach to what's going on too. We realize that these other social determinants of health come into play. And we act as then kind of the connection to these other pieces alongside working with an individual who is suffering from mental health and substance use disorder. And I love that you brought up the other piece that we talk a lot about, which is the diversion piece of this. In many locations, Iowa still being one of them, you have 2 options when you're dealing with this. You integrate with police and EMS, or you yourself take yourself or a loved one to the emergency room. And we know that both of those options aren't the best for people in this sort of crisis. And so access centers across the country are very good jail diversion places as well as ER diversion. And we are seeing that. I think at the last time when I pulled our quarterly report data, we have about a 76% diversion rate from individuals being brought in with law enforcement alone, meaning 76% of the people coming in with law enforcement would have either ended up in jail or in the ER, and we know they're not getting services there.
And is it also, are these people still charged by the police, or are they basically
They are not.
help without
Nope.
being charged?
They are not charged. So law enforcement in this way just acts as a mode of transportation, if you will, and using them to get connected to services. But no, they are not charged. We've worked really, really hard with law enforcement. We realize that that's a very historic system that we're trying to attempt to give law enforcement the tools that they need, but also realize that they're not the mental health professionals that they have kind of become because of what they're engaging with and what's going on. And so, no, we've done anything with training with law enforcement. They are not charged when they come. We've even had conversations about they shouldn't be handcuffed when they're in the car because they're not being charged with anything. So that law enforcement piece has been a really big piece that we've had to figure out how we integrate into this world. And they've been some of our biggest advocates as we've opened and expanded services.
Wow, that's sort of great news. We're going to take a short break. And after that, we'll continue our conversation with Erin Foster and learn some of these things that we don't maybe personally experience in our lives. See you all after the break. You don't want to miss this.
The black truck? Hey, Christina from accounting.
Yeah, hi.
Hey, I used to date a girl named Christina.
Oh, really?
Yeah, and then she dumped me for my best friend. You want to see some photos of them that I took?
I don't.
I thought we talked about this, buddy.
Buzzed and overshared again?
Yeah.
Yeah. I'm gonna call a car.
That's a smart idea.
So yeah, I know, that's why I did it.
Hey, you're gonna get back to the top of the mountain.
Does that mean I'm gonna get back with Christina?
No.
Oh.
No.
Every second, 127 new devices connect to the internet. You can feel it happening. Our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking with Erin Foster, the director of Lynn County Mental Health Access Center. Let's take a look at how they work to connect people with the help they need. Erin, there's two words that stuck out, triage and diversion. Can you talk a little bit about those concepts and what that means to the person that's interacting with your center?
Absolutely. I appreciate you asking that. We tend to use terms that sometimes mean a lot to us, but sometimes general public doesn't understand. So when I had referenced triage before, it was literally what I meant by that is the first encounter that people have with staff here at the Access Center. And I had made reference that it's a crisis counselor for us that does that. The triage portion of Access Center is actually one of the largest pieces if you look at the legislation that went into Access Center. And what they really wanted to look at was when someone comes in right away, what part of assessments are we doing? What part of evaluations are we doing? How are we deciding when someone comes in, are they going this way or are they going that way? So for us, the triage is done again by a crisis counselor who's been trained on a variety of different things, from suicide risk assessments to just seeing some of these signs and symptoms we see with mental health and substance use disorder in order to really come up with a well-rounded referral for the individual. So an individual is going to walk into our Access Center or come via different means. Law enforcement is one that we touched upon. And they'll sit down with the crisis counselor and ultimately just have a discussion about what brought you in today. During that time, that the crisis counselor is going to do a suicide risk assessment on you. They're going to do a brain injury assessment. This is really not to get like a clinical diagnosis. It's putting together these very holistic pieces of where are you at and what's the best thing for you right now? What can we work on more long-term? During that, then again, they're just having a conversation. What do you need? What brought you in? What do you want to come out of this visit? Access centers are very person-centered. We can make what we think to be the best referrals in the world. And if an individual just doesn't feel like that's what they have the capacity to do, or that's what they can do in a real world situation, we work with them on that. And so our triage team then is putting all of these pieces together, bringing in other partners that we have here at the Access Center. Sometimes we have situations come up in which we don't have a specific partner at the Access Center who does that, but we have a very good relationship with other community partners that would come in and help as well too. So we're painting this picture of what's going on right now in the individual's lives. And then we're making a recommendation for them. And that recommendation can be, hey, I think, it's in your safety and different pieces that you stay with us for a couple of days. We have programs where people literally stay with us on average of like 2 to 5 days, and we're working through a lot of things. Or it seems like you're really struggling to kind of figure out the mental health system. Let's make a phone call together to see if we can get you an established counselor, to see if we can look at what prescriptions may look like. Hey, it seems like you're struggling with food insecurity. Here's what we're going to do here now, but here's the other partner we're going to bring in to help you. And we really work together with the individual to bridge these gaps. We know with all of the services that we have here at the Access Center, if we didn't exist in this one building and had the ability to bring people in, we could be talking 5, 6, or 7 different appointments that potentially could be recommended for this individual. But we know the barriers to accessing those. And so if we can do those right here on site with you, that's what we want to do. Then anyone who leaves the Access Center, regardless of if you're just working with a triage counselor, you're staying with us for a couple of days, we're helping you getting established everywhere. Everyone leaves with this discharge plan. And it's what we discussed today. What things are we going to put into place? Here's your next appointment at the place that we helped you call, that we helped you get connected with. And here's more of the ongoing things. Regardless of what that discharge plan looks like, you can always come back to us. One of the things we keep track of recidivism, but to me, it means nothing, because if we formed this really good relationship, this safe environment, I don't care if you come back every day and we're working with you on different things. Every day is a new day for us to figure out what's going on and how we create this like really wraparound approach to helping you. On the diversion side of things, as you could tell with some of that explanation, a lot of these barriers that are around needing to go to multiple places or getting stuck and not knowing what to do can cause people to go to the emergency room. They can cause people to have interactions with law enforcement and an EMS. And so if we can build the system in which we are who you turn to, or we are who law enforcement gets you connected with, it really does divert people away from these other systems that they really don't need to go to. They're not at an ER level for specific things if they're just struggling. They don't need to have situations with law enforcement that they don't need to have and could potentially be detrimental to their future. And so if we can form the system and make people aware of the system, that we are who you can come to in the first place, and we can get you connected to things, that diversion piece just makes sense. And again, we knew it could do this. The data has obviously followed it. And so it's a really important piece for us that we have that no wrong door approach. We will help you figure something out. It may not be the best thing, the highest level thing, that the thing that we can take care of, but we will figure something out with you and then make it something that you can do on your own as well too.
And in fact, you're going to stop for a break, but it's not a get out of jail free card. They have some responsibilities.
It is not. No. There's some follow up with it. Yes. Yeah.
When we come back, let's talk about that and explore sort of the challenge of building bridges to healthy intervention, treatment, and healing services. See you all after the break.
Multiple studies have shown that marijuana can slow both driver reaction and response time, which can be really dangerous. He's here. He's here. Wait. What? I can't drive. Why? My. Oh.
Today, more than ever, you need fast, reliable internet. At MediaCom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected. Every second, 127 new devices connect to the internet. You can feel it happening our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. We're with Aaron Foster talking about how the landscape has changed for mental health and substance use disorder services, and importantly, how you can navigate your way to success at a difficult time in your life. Aaron, coming back to this concept about, this isn't the get out of jail free card. There are some responsibilities, but there are opportunities too, without any cost, to get some real needed help. Talk about that with us.
Absolutely. Yeah. So we have several services here at the Access Center that actually there's no cost attached to it, meaning there's no billing mechanism in place for them. So we have different funding supports that we look to for those. One of them happens to be our sobering unit, which is probably our unit most used by law enforcement. And the unit that we tend to see people come into that would really work into our data with jail diversion. A lot of the people that are coming in are having interactions with law enforcement. They're intoxicated, and instead of taking them to ER or taking them to the jail, we are an option for them. As I mentioned before, no one's charged when they come in, and it's a very low barrier program. You're coming in, you're being medically monitored by EMTs. There's really not a lot of questions asked. It is one of our programs that triage is actually done on the back end. And so when an individual has reached a level of sobriety that we can start asking some more questions, digging into different things, it's the same thing as if an individual walked into the door. We're asking, like, what's your crisis? How did you get here? What can we help you with? And, we've had individuals who, as they've reached that level of sobriety, to have that honest conversation with us, as we're doing suicide risk assessments and we're doing just general mental health assessments, they do get placed into some of our program because they understand potentially having interaction with law enforcement because you're intoxicated was due to some of these things. And so, again, just like that program, which incorporates law enforcement more often, then not the same type of thing is happening with those individuals. They're working with a crisis counselor. They're getting the services that they need. Again, it's still completely person-centered. So if they're having a conversation and they just decided, this isn't for me today, there's no level of times people can come to us that we would cut them off. And so we do see individuals on a regular basis, specifically in sobering, where they may come day after day or on the weekend. And then maybe it's that next time then that they're like, yeah, maybe we should have a conversation about substance use disorder.
Well, now that sounds really good for people motivated for change. And sometimes it's shock, like meeting the police are motivated for change. But I'm thinking, all right, let's say I get in trouble. And I think, a magic word, say diversion. And I'll just go sign a few papers, talk to a few people, and I'm not. I mean, there's still the stigma of getting help. There's still the powerful ability of mental health issues and substances to take control of a person's life that make it hard for them to agree. Now, are there like repeat offenders? As the police brought back some people several times? Does your number of chances run out? I mean, how do you deal with the fact that just because the police are bringing them to you, that doesn't mean they're going to want to deal with you?
Right. No, there's no level. There's no quota that we hit. There is no number of, 3 strikes you're out rule that does not exist with us. And I think that's just kind of the human nature, specifically speaking to substance use disorder. There's that human nature of understanding the stages of change, where individuals are at, and maybe an encounter with law enforcement isn't your rock bottom. Maybe it's not where it would still kind of bump you up into a stage in which you're ready to care. And I think one of the things that we just pride ourselves on it, and we make sure is really, really important, that regardless of what's going on, we're here. And so you may have come in to us 6 or 7 times. You may have worked with the same EMT, the same crisis counselor, and it's that 8th time that then you're like, well, maybe we should dig deeper. And we have seen that happen. We've seen people repeatedly come into sobering, repeatedly working on different things. And then it's that next time where it's like, you know what, I do want to talk to the counselor today. or we get calls from loved ones saying, I know my significant other was there. What can we do to help them? And we'll have that significant other come in. I also think there's this thought that like we only work with the individuals that are in crisis. If you are a loved one or you have a significant other or that type of thing, and they are dealing with a mental health or substance use crisis, you yourself are as well too. And so we really also work with the other people that are just integrated into, we know substance use disorder and mental health has this trickle effect, and there's lots of people that are affected by it. And so we'll do work with a family member, with a loved one, and that type of thing too. So to answer your question, no, there's not a number of times where we cut you off. We are always here. We're always going to have the conversation with you. We are always going to keep you safe. And if it's that 8th, 9th, or 10th time where something sticks and you want to do something, we're really glad you came to us and we can help you do that.
So now let's take a look at somebody thinking about mental health. There's sort of a spectrum where, one might be anxiety and a little bit of depression. And then at the other, what I'd call an extreme might be suicide ideation. And then, of course, there's psychotic breaks and schizophrenia. I mean, there's a lot of stuff in that spectrum. Is the recognition that somebody has some sense of feeling like that enough? If somebody's depressed, should they call you?
Yep, absolutely. And then, I mentioned to you before, kind of in the opening, we do not define someone's crisis. And we have seen in the last 2 years a very big spectrum of people who have, said, I've never felt like this before. Someone told me maybe it's anxiety. Like, what can you happen to me? Or I've never felt this way before, or there's, different things going on. Maybe I have depression, to full psychotic episodes like that. Like you said, that spectrum of what people are experiencing and at what threshold they decide to talk to you about it is completely up to them. And so this is not a check the box. This is not you're not as in crisis as you should be, so come back tomorrow when you're really in crisis. We want to work with people at whatever level they are comfortable coming to us.
This is just fascinating. And we have some more time to spend with you after a break. And after that break, Erin's going to share some final comments, insights, and inspiration. Stay tuned. You don't want to miss this.
Today, more than ever, you need fast, reliable internet. At MediaCom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected.
The black truck? Hey, Christina from accounting.
Yeah, hi.
Hey, I used to date a girl named Christina.
Oh, really?
Yeah, and then she dumped me for my best friend. You want to see some photos of them that I took?
I don't.
I thought we talked about this, buddy.
Buzzed and overshared again?
Yeah.
Yeah. I'm gonna call a car.
That's a smart idea.
So yeah, I know, that's why I did it.
Hey, you're gonna get back to the top of the mountain.
Does that mean I'm gonna get back with Christina?
No.
Oh.
No.
Welcome back. Today on Surviving Bad, we're talking about mental health access centers and how they contribute to building a healthier community. And we have Erin, who has quite a bit of experience in prevention as a trainer and working in our communities, and now being director of the Access Center in Lynn County. Erin, what insights do you have to share for us?
I think, we try to look about silver linings of the last couple of years because they've been very difficult. You have COVID, again, from the Cedar Rapids area, we dealt with the derecho. And one of the things I look back and I think of silver linings about opening something like this, even in the middle of COVID, is there is a lot more conversation around mental health and substance use disorder. And I think that has really helped us get the word out and talk about outreach and talk about coming in. And it's, this whole concept of it's okay to not be okay. And so when I really think of the last couple of years and opening and what we've dealt with here and that type of thing, one of the biggest achievements I think we've had as a state in general is the promotion of it's really okay to ask for help, and that your neighbor is struggling to, your coworker is struggling to, and it's really okay. And I think this concept of access centers coming on in the state of Iowa at the time in which they did was perfect timing. And I'm very excited to watch us grow and see what comes from that.
We know that urban areas have their share of policing, any place you have a higher population density, but how are you connected with the rural populations? What do you see there as a trend?
Yeah, that's a great question. As I mentioned before, we're a regional access center, and in our region, there are 9 counties. 3 of them are a little bit more urban. You have Johnson and Lynn County and Dubuque County, but the other 6 are rural. And so that conversation in general about getting help and what that looks like and that type of thing is really different in the rural communities. It's really about making relationships, building that rapport, making it okay that now maybe it's okay to travel a little bit to get help. And one of the things that I'll make connection to is nobody will question if you go to a doctor and they say, I think you should go to the university for this. I think you should go where the specialists are and where they have a more robust system for you. So why are we questioning travel to another location, to a more urban area to get this a little bit more robust of a system to you? So the rural communities have also wrapped, their heads around different things like transportation and what that looks like. The other piece that I tend to talk a lot to the rural communities about is, even though they receive services here in Cedar Rapids, we will do our best to connect them to services back home. So if someone from Dubuque County, say, comes to us, we realize they got a 45-minute to an hour drive here. We're not going to set up their discharge plans and their appointments for here in Cedar Rapids. We're going to make those connections for them in Dubuque County and surrounding areas. And so it has been a little bit more of a different conversation with the rural communities than here in Cedar Rapids. We realize the law enforcement piece looks different, that there are CRPD patrol in my neighborhood. It's very easy for them to bring people here, but what does that look like for the Butte County Sheriff's Office, and how can we make accommodations for them? The other silver lining with COVID we talk a lot about is the piece that telehealth plays into it. We've created a system specifically for the rural areas that they can do the triage portion via telehealth. So we can give them the direction before they do drive the hour here, and we can figure out what we're going to do before they get in their car and make the drive here. So there's been some accommodations that need to be made. None of them have been difficult to do, but it's really just thinking outside of the box. Access centers are innovative to begin with. There's no reason we can't take our already innovative ideas of putting this all together and continue to have innovation tied to extra access. When you have a name like the Access Center, access should not be a barrier to it. And so we've worked really well with the rural communities in that regard.
Yeah, and I think we see that, we talk about Iowa strong, or even just people strong. And it used to mean hiding your emotions, big boys don't cry, all that kind of stuff. Yep. But it doesn't mean not getting help when you need help.
Absolutely.
There's some common sense to that. And I really appreciate that approach with the access centers. And I wish you all the luck in the next couple of years when we probably will hear from you again. Thank you for joining us today. And thank you all for watching. Check out our website at healthyiowa.org and keep your eye on MediaCom MC22 for our next episode of Surviving Bad, where we explore stories of survival, hope, and inspiration. On MediaCom MC22, your local programming leader.